Good afternoon, everyone. Bon après-midi. Près de 100 jours se sont maintenant écoulés depuis que le premier cas de COVID-19 a été confirmé au Nouveau-Brunswick. Depuis, 160 personnes ont contracté le virus dans la province, 19 ont dû être hospitalisées et 2 en sont décédés. Nous avons trop souvent l'impression que nous ne parlons que des statistiques, c'est-à-dire des chiffres remplissant une feuille de calcul ou des lignes sur un graphique à barres. But we know that each of these numbers represents a person who is one of our fellow New Brunswickers, a person who has lived and loved with family and friends who care for them. We must also care for them. We pray with their families and friends when they become ill and celebrate with them when they recover and grieve with them when a loved one dies. Au cours de la dernière fin de semaine, un deuxième décès attribuable à la pandémie de COVID-19 est survenu au Nouveau-Brunswick. Il s'agit d'une personne octogénaire avec des problèmes de santé sous-jacents qui était hospitalisée à l'hôpital régional de Campbellton. Cette personne résidait au manoir de la vallée à Atholville et était l'un des 21 cas liés à l'éclosion dans cet établissement résidentiel pour adultes. Out of respect for their privacy, I won't say any more about this individual other than to offer my sincere and heartfelt sympathy to their loved ones. All of New Brunswick grieves with you today. There are 3 new confirmed cases of COVID-19 to report. An individual aged 20 to 29 in Zone 5, which is the Campbellton-Restigouche region, and 2 individuals aged 20 to 29 and 30 to 39 in Zone 1, the Moncton region. The 2 cases in Zone 1 are temporary foreign workers who were in isolation at the time of their diagnosis. As with the confirmed case last week, these workers were tested on the 10th day after their arrival in the province. And again, we're following very strict protocols around temporary foreign workers. So each and every time people come into the country who are temporary foreign workers, the same procedures and protocols will be followed. So in each and every time when we identify a case, again, the same protocols and procedures will be followed. They'll be isolating at the time of their testing, and they will continue to isolate until they are tested twice within a 7-day period before they go back to work. These individuals have had minimal contact with others since arriving in New Brunswick, and the protocols we put in place to protect their health and that of all New Brunswickers appear to be working. And again, we will continue to use the same protocols and procedures each and every time temporary foreign workers come into the country. So again, and I'm very, very pleased with the work that Public Health is doing around this, and we have had collaboration with all of the partners with respect to testing, et cetera. So quite a mobilization and collaboration is occurring, and I'm very grateful for that work and very proud. So, il y a 3 nouveaux cas de COVID-19 à signaler dans la province aujourd'hui. Une personne âgée entre 20 et 29 ans dans la zone 5, soit la région de Campbellton-Restigouche. 2 personnes âgées entre 20 et 29 ans et l'autre entre 30 et 39 ans dans la zone 1, soit la région de Moncton. Les 2 cas dans la zone 1 sont des travailleurs étrangers temporaires qui étaient en isolement au moment où ils ont reçu leur diagnostic. Et comme pour le cas confirmé la semaine dernière, ces travailleurs ont subi un test de dépistage le 10e jour après leur arrivée au Nouveau-Brunswick. Et les protocoles vont continuer comme ça, au fur et à mesure qu'il y aura d'autres travailleurs étrangers qui viennent à la province. Et c'est des protocoles de santé publique ils vont continuer à renforcer. Et il y a beaucoup de collaboration avec la santé publique et d'autres partenaires pour faire sûr que les dépistages sont faits et les résultats sont vite donnés aux santé publique et les résultats vont déterminer les actions après ça. Et ça va être la même manière chaque fois qu'il y a des travailleurs étrangers qui arrivent. Our public health teams are working hard to limit the spread of COVID-19 virus throughout our province. And while we are moving forward with recovery, it remains as important as ever that each and every New Brunswicker do their part. And no matter where you live in our province, it is important to maintain physical distance from others whenever you can. And when that's not possible, I strongly recommend that you wear a community face mask that covers your mouth and nose, regular hand washing, coughing and sneezing into your sleeve, and avoiding touching your face. We do know that the higher risk interactions occur indoors, and so when you are indoors, it's even more important, and especially in your own home. So be conscious and aware of hosting people in your home with respect to those risks. And then if you are planning something, obviously outdoors carries less risk. So those are how you can prioritize your actions and your decisions and your behaviors. Those who are working in close contact with COVID-19 patients must take additional precautions. In recent days, we've seen 8 confirmed cases among workers at the Campbellton Regional Hospital, where a number of COVID-19 patients are being cared for, and this includes the new case confirmed in Zone 5 today. Je vous signale que tous les membres du personnel de l'hôpital régional de Campbellton et du centre hospitalier Restigouche sont en voie de subir un test de dépistage. Le réseau de santé Vitalité a publié une directive à l'intention du personnel de l'hôpital régional de Campbellton et du centre hospitalier Restigouche situé à proximité afin de retirer les mesures nécessaires pour s'assurer que les travailleurs de la santé se protègent pour leur bien-être et celui de leurs patients. The Vitalité Network and their staff are redoubling their efforts to ensure that all protocols are being followed as per public health guidance and infection prevention and control guidelines. And again, seeing great collaboration. Throughout the pandemic, we identified early on that there would always have to be planning and organizing of the protocols and making sure that information was disseminated. And as we learned new pieces of information, that those would be incorporated and we would adapt and learn together. So the fact that these things are happening right now in the Campbellton area with Vitalité and public health and AMB, it's really, really positive work being done. A directive reiterating and reinforcing the policies to be followed was communicated to staff, and additional training has been put in place for all staff on site. This situation is a reminder to all healthcare institutions and workers across the province that though we may be tired and that our protocols might seem repetitive and an overreaction considering the absence of community transmission, they are not. They are essential. Infection prevention and control protocols and public health guidance is our first and only line of defense against this virus. So we might get tired of face masks and face shields and other protective equipment. We need to remind ourselves every day that the alternative is potential spread of the virus to colleagues and patients. So sometimes, even if we do all the right things, the virus still finds a way. It is very tenacious. So we have to be very vigilant. I don't like to use that word too much, but I think in this case it is true. So however we can support each other in our attempts to follow all these protocols and support each other is very, very, very important at this time. So in Campbellton, even if we need to retrain, reinforce, and make sure we put everything in place to protect our staff and patients, it's very timely, obviously, at this time. So the outbreak continues, but with continued hard work by our teams and patience from the people of the Campbellton-Restigouche region and around the province. Again, I think we should be very supportive of people in the Campbellton-Restigouche region, and in fact, I do know that there are, with the call out to GNB staff to go up there, I think we're up to 12 people who are going up there, and I know there was one person from here working in Chancery Place who was going up there today. So a big shout out to those people who are going up to the region to help out at this time. So again, hopefully that situation will be under control very soon. And again, we watch and wait as each person is self-isolating who is a close contact of the cases as the contact tracing happens. Alors, un gros merci à tous nos partenaires qui travaillent tellement fort pour collaborer avec la collaboration de Vitalité, Ambulance Nouveau-Brunswick, le programme extramural, et santé publique. Il y a tellement de nombre de gens qui participent dans la collaboration maintenant pour améliorer la situation et gérer la situation au nord. C'est tellement apprécié. Un gros merci. Thank you.
Bonjour, good afternoon. I want to begin today by expressing my heartfelt condolences to the loved ones of Rodney Levi and to all members of the Metapenagia First Nation. As a province, we are still mourning the death of Chantal Moore in Edmundston earlier this month. Je sais que tout le monde je pose des questions sur ce qui est arrivé exactement durant ces incidents. Moi aussi, je me pose des questions et je veux des réponses. Both incidents are currently under investigation by Quebec's Independent Police Investigation Agency. We are still waiting to learn all of the facts, but the process of beginning to heal and implement real changes cannot wait. On Wednesday, I will also attend the previously scheduled meeting with First Nation chiefs. The meeting will include Jake Stewart, the Minister of Aboriginal Affairs, Carl Urquhart, the Minister of Public Safety, and Andrew Anderson Mason, the Minister of Justice and Attorney General, as well as Dorothy Shepherd, the Minister of Social Development. This will be an important opportunity for us to hear the chiefs' concerns. It will give us a chance to have open discussions about how we can work together to address these concerns. This must be a time for us as a government to listen. Together, we can take an important step forward in addressing issues and making lasting changes. On the weekend, we also heard the sad news that another person between the age of 80 and 89 died due to complications related to COVID-19. Cette personne était un résident de manoir de la vallée à Atherville. Je veux offrir mes condoléances à la famille et aux amis de cette personne et à toutes les personnes de la région de Campbellton. 2 of today's 3 new cases are temporary farm workers in the Zone 1 Moncton region. While of course it is always a concern when someone tests positive for COVID-19, finding these cases shows that the system is working. These individuals are in isolation and will continue to isolate until they have recovered. We have the procedures in place to test temporary foreign workers to minimize the risk of spreading COVID-19. Nous prenons ces cas au sérieux, mais nous ne pouvons pas nous permettre que notre économie soit paralysée. Ces travailleurs ont un rôle important à jouer pour nous aider à redémarrer notre économie. Nous devrons continuer à faire des progrès tout en continuant à trouver un équilibre pour assurer la sécurité des gens de Nouveau-Brunswick. Our province was quick to take action and slow the spread of the virus, and that has allowed us to begin reopening our economy earlier than many provinces. Our recent report by RBC confirms that we are on the right track, and our quick response is giving us a head start when it comes to economic recovery. The report predicts that New Brunswick can expect to recover 95% of our February 2020 GDP by the end of this year. This is an encouraging sign that the economy is on the rebound, but we also know that there are still challenges ahead of us. There will continue to be ups and downs in the months ahead. Pour redémarrer notre économie, tout en protégeant les résidents, il est essentiel de continuer à assurer un contrôle serein à nos frontières. Nous allons continuer à surveiller de près les frontières de Nouveau-Brunswick et nous allons assouplir les restrictions uniquement quand ce sera sécuritaire de le faire. I want to discuss Bill 49, a new bill that was intended to bring clarity to the law and emergency powers as it relates to our efforts to minimize the risk of COVID-19 in New Brunswick. We have seen in recent weeks the conversations that are taking place around the world. We've heard the concerns from the public and from the opposition parties surrounding this bill. The bill was prepared with the best of intention, but given those concerns, we will not be proceeding with it. Nous devrons nous assurer d'avoir des conversations plus approfondies avec les chefs autochtones, les professionnels de la santé et tous les dirigeants politiques dans les semaines et les mois à venir. Et nous sommes déterminés à le faire. As I said earlier, I've heard the calls for dialogue on the concerns of our First Nation chiefs. That is what I want our government to focus on right now. Healing from what has happened is going to be a long process, and it is not going to be easy. I take the concerns of our First Nations communities very seriously, and we must all listen with compassion and with an open mind. By working together, I'm hopeful that we can find a way to make meaningful changes and move forward united. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci à toutes et tous. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Andrew Watt, Telegraph Journal.
Thanks, Bruce. Premier Bill 49, I mean, as recently as Friday, you were still kind of defending the bill and saying, well, it could need to be amended. Did Friday night change things for you?
Yes, Andrew, I think Friday night changed things for a lot of people, and including myself. We certainly have to recognize the challenges we're having here in our province, the systematic racism that seems to be part of our society that has been for generations. We have to recognize that Bill 49, although being certainly with all good intentions, was only to ensure that people understood the people that are guarding our borders had the appropriate authority in order to continue that as we deal with COVID-19. It was certainly related to COVID-19. But in relation to what's happening in our province, across our country, certainly in our neighboring country in the U.S., I think it's important now to focus on the healing process and certainly what needs to take place in order to ensure that we can identify some of the chronic concerns maybe that have lasted for generations that have not been effectively dealt with. And to that end, I feel that there are priorities that we can collectively put together with the chiefs, focusing on New Brunswick and our issues here right at home, and make some meaningful progress.
Thank you, Premier. Mr. Watt, do you have a follow-up?
I do, thanks. Premier, what do you hope to get out of this meeting? And is it going to be a one-off, or is it going to be an ongoing thing? And will the other political leaders be involved in this?
Well, it's early to say about how widespread. I think that it certainly won't be a one-off. I would certainly say if we're going to have a meaningful progress, we need to set up a series of meetings. But really finding out, as much information that has been gathered in the past that has not been reacted to in a meaningful way to get results. When I say that we need to come in with certainly an open mind, it's like we all need to think about how do we move our society forward together. How do we work together in the province we love to have meaningful and sustainable change? So I expect there will be multiple meetings, and I do think it would be appropriate to have our other leaders, other parties engaged in this process, and maybe it can be part of a continued COVID cabinet process. I'm not sure at this point. Right now, we're just focused on having a very meaningful discussion on Wednesday.
Thank you, Premier. Thank you, Mr. Watt. Mia Urquhart, CBC.
Thank you. My question is for the Premier. With contact sports not included in the yellow phase, it appears as if they won't be allowed under the recovery plan until a vaccine is found. So what is the status of contact sports like rugby and football and hockey?
So my understanding is there's some guidance documents at the national level and the provincial level that we have provided to tourism and culture and recreation so that they can have discussions with different sports organizations to determine the types of risks that they have in the types of sporting activities that are happening.
Thank you, Doctor. Ms. Urquhart, do you have a follow-up?
So I guess, I haven't got the details in what's been announced today, and I think we have to balance what we're doing here in relation to how we ensure that people are being protected. But as I've pointed out in New Brunswick, and what the forecasts are from the most recent, like RBC as an example, is that, we expect to be 95% back as the months progress. And that's an ambitious target, but it's one that we're not setting. It's one that we want to be 100% back, but it's one that's being forecast from outsiders, which I guess we'd like to think makes it more relevant in that sense. But so I need to understand more what the Prime Minister is proposing here, but we have to be very cautious because one of the biggest things that we're getting in terms of our businesses starting up is certainly having an adequate workforce, and that, so we have to balance that. The other thing is I spoke to many times with the Prime Minister in our meetings that we have weekly, has been, what does next year look like? Are we thinking about next year and the year after? Because I'm thinking a lot about that, and how we can have a path forward that doesn't see huge increases in taxes, but it sees an economy that continues to grow, and then we keep giving the freedom for people to grow in this new COVID world. Because it's not about sitting around and waiting for a vaccine. It's about managing our business and moving forward until it arrives and beyond.
Thank you, Premier. Thank you, Ms. Urquhart. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, the Campbellton ferry started for the season today, but islanders are still concerned about what will happen in September when it ceases operation. I spoke with MP Williamson on Friday, and he said he's waiting for a proposal from the province so that the federal government can contribute to a solution for a year-round ferry. Do you have an update on where Minister Oliver's office is at in terms of drafting a proposal?
So we had, it's been back now a month or so ago. It's hard to have any little good news to last very long, isn't it? So it's nice the ferry's up and running and for the summer season. I haven't had an update recently from, I think I gave one here from our discussion with the mayor and looking at the options. I said I would look at the economic options for the island, but I wasn't particularly understanding of how that would work feasibly and where the federal government might stand and all that. So I will ask for a current update, but it is nice to hear the ferry was up and running as we'd hoped it would be by this time.
Thank you, Premier. Ms. Hogarth, do you have a follow-up?
I do. Thanks, Bruce. It's also for the Premier. Premier Higgs, given that Ottawa may still be waiting for some time for a proposal and the borders are still restricted to essential travel, would the province be willing to subsidize the ferry for use by island residents to reduce resident out-of-pocket costs to reach the mainland like it already does for other Fundy Isles?
Well, if we had a situation where the restriction to move through Maine to get to New Brunswick was actually impeding traffic, and I don't mean just to the fact that you've got to drive straight through and not stop in Maine or essential services and how that's being provided, but it's my understanding that there aren't any restrictive border requirements that would limit someone from coming into Maine going right through to New Brunswick. So I would need to understand what those look like if there are some that I'm not aware of. But I would work with the governor and work with the state of Maine in order to deal with those, because I think that's first and foremost where we need to head here is make sure that we can have movement, as we always have, through Maine to New Brunswick.
Thank you, Ms. Hogarth. Thank you, Premier. Michel Corriveau, Radio-Canada.
Oui, bonjour. C'est une question pour Monsieur le Premier ministre Blaine Higgs. Monsieur Higgs, si vous avez votre oreillette, je ne vous vois pas pour le moment. Alors, Monsieur Higgs, vous avez mentionné tout à l'heure le racisme systémique au Nouveau-Brunswick qui est là depuis des générations. J'aimerais que vous nous expliquiez qu'est-ce que c'est exactement ce racisme systémique qui serait là depuis longtemps au Nouveau-Brunswick.
So I think, Michelle, what we have seen here in this situation, but what we've had as a question for a long time, are people being treated equally as we would expect and cherish in our province? And there is an inherent belief that that is not the case. And so that has existed for generations, that one societal member is not treated the same as another. So I think what we have to really put out here is not we think that's the case or we believe it to be the case. And I think we all think there are situations that would question, okay, well, what could we have done differently, or is this an example? But I think we have to be careful to make sure that we do put all the facts on the table, that we get a clear understanding of the issues at hand, and we respect both the individuals and we respect as well, you know, our peace officers and our police officers, because it's we have a society of order and we have a society that needs to continue to operate and continue to get better. And we'll only get better if we continue to understand the real issues, real issues that maybe have not been dealt with for generations that we need to speak of and have a path to rectify.
Thank you, Premier. Monsieur Corriveau, as-tu suivi?
Oui, merci Bruce. Alors, Monsieur le Premier ministre, ce dont vous parlez, c'est un grand projet, un projet de société. Est-ce que ça ne vaudrait pas qu'il y ait, que ce soit une enquête publique, que ce soit sous une forme publique où tout le monde peut être d'une certaine façon impliqué?
You know, I think this becomes certainly a bigger issue than these events, which are certainly big enough, tragic enough, that we've seen in the recent weeks. And yes, that might be the situation. And I've never said that, excuse me, a public inquiry wouldn't happen. What I've said is I wanted to understand the details around these cases, and that's why we have an independent review process that's being conducted, so that we're not speaking from what we think happened, but we're actually speaking from knowledge of what did happen. And then you move that into the next phase of the bigger issue and the societal issue, which to your point. So yes, I could see that moving forward. I could see it moving forward in a public inquiry that's well-defined, so that we're sure to capture all of the issues that are currently maybe of a concern. But I was first wanted to get an understanding of what we've seen in recent weeks and know that what's the reality of both of these tragic events.
Thank you, Premier. Merci beaucoup, Monsieur Corriveau. Elizabeth Fraser, CBC.
Hi there, my question is for the Premier. For people outside New Brunswick who have seasonal residents here in the province, how should they go about coming into New Brunswick? Do they need to bring or sign any formal paperwork, or can they just show up to their property?
Well, they won't just show up, because they'll come through the border, and then at that point they'll be asked questions about where they're going and why, and if they have property here in the province, the details of where that's located. I think that in order to formalize it so it makes it less maybe concerning for the individuals, it would be to actually call the number to get information and make more or less an application or identification. So then a response can be sent to them, and then they will have that in their possession when they come to the border. And then that way, there'll be no issues. They'll know they won't have a problem at the border, and they'll be able to go immediately to their resident.
Thank you, Premier. Ms. Fraser, do you have a follow-up this afternoon?
Yes, I have another question for Dr. Russell. Regarding New Brunswick's second death related to COVID-19, can you say which part of the long-term care facility the individual was living in, and what is being done now to protect residents in that part of the long-term care home?
So my understanding is it was the original wing where the first cases had been identified, so that was the affected ward. And they've done such a tremendous amount of work in that facility since all of this started, from making sure that the residents and the staff were tested regularly, making sure that that all the patients were self-isolating. And again, Ambulance New Brunswick and Extramural have stepped in to help. Vitalite has helped. And in some situations, actually, Horizon has been helping as well, all working with our public health team up in the north. So it has been quite a collaborative effort. And again, we are sad that we've had 2 deaths from that outbreak, and hopefully we won't see any more. But again, we have to sort of follow through with all of the work that's been started and carry on with what we know will protect the patients and the staff. And again, at this point in time, we're not allowing staff to move from facility to facility, so that is one of the protective measures that's in place now. And obviously, all the infection prevention and control strategies continue, and the healthcare workers are very vigilant at this point in time about completing self-assessments for symptoms prior to shifts. But again, when we do the testing, and in several cases, whether it's healthcare workers or patients, there have not been symptoms. So that's why the testing part is really important. And again, Extramural has been doing great work in terms of leading the coordination of the clinical and supportive care at the facility. So as I said earlier, we are getting better and better at learning from these experiences. The planning pieces and the coordinating pieces early on have been helpful, but each time an incident or an event happens, we have to always be ready and willing to learn and adapt as things move forward. So there has been quite a bit of learning from these events up in the northern part of the province, and we will continue to be taking those learnings and applying them moving forward, so we can make sure that that everybody has the best information and awareness and education moving forward. And again, we need to always remember to be supportive of the work that's being done and help our frontline workers feel supported. I think it's a very stressful time for people on the front lines, and if you know any frontline workers, reaching out to them at this time would be very helpful. So keep that kindness and compassion at the forefront of your mind, and also dealing with any of the residents who are up there, reaching out to them and offering them support.
Thank you, Ms. Fraser. Thank you, Dr. Russell. Item here is Telegraph Journal.
Thanks, Bruce. Question for the Premier. Premier, Prime Minister Justin Trudeau says he's asked the provinces to ban commercial evictions. New Brunswick had that in place until the end of May, but then let it lapse. Since then, most other provinces have done it. Will you again ban commercial evictions? Why or why not?
At this point, I don't think we will be banning them. However, we have asked for any particular business to talk with Opportunities New Brunswick to basically understand the situation. We haven't seen a huge appetite for the previous program, federal program that was in place, nor have we seen a large number of evictions that have taken place. At least certainly I'm not aware of that. So we have said that we want to understand, is this an issue or is it not? It's part of getting back to normal. We don't think that landlords want to lose their tenants any more than a tenant wants to be evicted in all these commercial spaces that you know, where else are they going to go at this point? And where else is the landlord going to go at this point? So I think this is moving in a direction as we open up. People are getting in a position they can start to pay their monthly rent. And it's moving as usual, as we hoped it would, I should say, not as usual. I am pleased with what I'm seeing happening out in the workplace and with our economy starting to rebound. We're seeing it progressing well in most, if not all, sectors. So I see no reason at this stage to further implement that policy.
Thank you, Premier. Mr. Harris, do you have a follow-up this afternoon?
Yes, please. Again, for the Premier, a follow to the Trudeau wanting to extend the Canada Emergency Response Benefit. I wanted to know your thoughts on the extension and whether you could do it regionally in some regions, and if you've advocated in your calls with the Prime Minister not to see it happen in New Brunswick because it's done better, similar to, say, the EI parameters that are different in different regions of the country.
Well, I am concerned with just a blanket extension because that's the main issue that I'm having, are employers not being able to get employees, not finding workers. So there has to be a balance here to ensure that people that are unable to work, or if jobs aren't available and it's COVID related, that there's protection and a safety net in that regard. But just to arbitrarily extend it in every province, you know, that can limit, I'll put it this way, it can limit our economic recovery and the speed of which we can recover. So I would like to have it be a more wholesome discussion. And basically, we've asked for this throughout the entire session with the Prime Minister. It's been, we need flexibility to do what's right for New Brunswick, and other provinces have argued the same thing for what's right for their province, in order for us to see us moving back to our new norm in COVID. And so one policy doesn't fit all, and we know the struggles we've had with some of them.
Thank you, Premier. Thank you, Mr. Harris. Éloi Rodriguez-Quillebage, Radio-Canada. Éloi, Radio-Canada. Éloi. Colin McPhail, CBC.
Hi, my question is for Dr. Russell. Given the presence of COVID-19 among some staff members at the Campbellton Hospital, what are the restrictions now on the use of N95 masks, and why not make them available more widely?
So we have provided guidance to the RHAs throughout the pandemic, and we receive our guidance from the Public Health Agency of Canada. So we've had many discussions at the task force level around which type of equipment is appropriate to be used in different situations. So certainly we manage our supplies quite well. We have weekly meetings on what the supplies look like and where we are in our stockpile. So, and that information is communicated again with the RHAs and our partners, EMAMB and the nursing homes, and also with other partners. So as of right now, the situation in Campbellton, they are reviewing all of their protocols right now and reinforcing whatever measures we've talked about from the beginning of the pandemic. So that's happening. And with respect to N95s, the guidance from Public Health Agency of Canada, as well as our own provincial guidance, is around N95s being used for aerosol generating medical procedures. And that's been the advice through the entire pandemic. So an aerosolized generating medical procedure would involve things that would cause the COVID-19 virus droplets to become airborne. And so those situations are clearly outlined and defined in the protocols and the guidelines. So there is definitely access to N95 masks for all of those situations in all the clinical settings where they're required. And so again, there was a recent memo that went out to Vitalité's staff, again, highlighting all of the protocols and measures that in terms of reinforcing and reminding what things should be followed. But certainly there has been no change in when N95 masks are supposed to be used. And again, those are clearly outlined in Public Health Agency of Canada guidelines and then our own provincial guidelines that have been provided to the RHAs.
Thank you, Dr. Russell. Mr. McPhail, do you have a follow-up?
I do, thank you. Again, for Dr. Russell, you mentioned earlier in your remarks that the hospital is redoubling its efforts. You just mentioned that they're reviewing the protocols to reduce the transmission in the facility. What specifically do you see changing in terms of protocol to protect staff?
Well, in the memo that they released, they highlighted again when to wear personal protective equipment in terms of what type of settings to wear certain types of equipment, making sure that they continue to physically distance, issues regarding break rooms, cell phones, and things like that. So just making sure that all of the issues around making sure that where people change and don and doff their equipment, all of those things are highlighted and reinforced.
Thank you, Doctor. Thank you, Mr. McPhail. François Leblanc, Radio-Canada.
Oui, c'est une question pour le Premier ministre Higgs. Monsieur Higgs, il y a la fermeture des services essentiels, mais surtout du service d'urgence dans l'hôpital régional de Campbellton. Pour la deuxième fois en troisième semaine, il y a beaucoup de gens dans la région, des intervenants dans le monde de la santé qui se disent, je me demande comment vous pouvez justifier qu'une région aussi grande que le Restigouche se retrouve encore une fois sans service d'urgence à l'hôpital régional à cause de l'éclosion de COVID-19. Il y a des leaders de la communauté qui disent que ça devrait peut-être en ce temps de crise d'être un service essentiel maintenu.
So I think it's important to realize that the healthcare services in the region are managed by Vitality. They make the call on their facility, what's required in order to ensure that they can meet the required health standards. They've provided options and for emergency services. And so I think we have to rely on our health professionals as we've done through this pandemic, whether it be public health or whether it be Horizon or health authorities, or in the case of oversight with the pandemic task force for both Vitality and Horizon participating in the decisions that we've brought forward. So I think it's important to respect the capability and the decisions that are being put forward as in the best interest of the region, for the region at this time, as we seek to control the spread of the virus through any of the regions. It's critical that we contain it, and they're doing their part to ensure that happens.
Merci, Monsieur le Premier ministre. Merci, Monsieur Leblanc. As-tu un suivi, Monsieur Leblanc?
Oui, une question pour Dr. Russell. Il y a beaucoup d'intervenants du milieu culturel qui se demandent quelle est la logique derrière le fait qu'on peut permettre à un lieu de culte, comme une église, par exemple, d'accueillir une cinquantaine de personnes pour l'office religieux alors qu'on donne la communion, etc., alors qu'il y a des salles de spectacle qui peuvent pas ouvrir, ne peuvent pas présenter de petits spectacles à petite échelle?
Moi, j'ai compris que oui, c'est le cas avec les services religieux qui peuvent être un maximum de 50. Je sais qu'il y a des petits venus qui sont acceptés des plans pour avoir de la musique, des choses comme ça. J'ai déjà entendu qu'il y a des endroits où ils peuvent garantir, donner une garantie pour qu'ils puissent faire la distanciation physique. Je sais qu'il y en a qui se fait dehors aussi.
Merci, docteur. Merci, M. Leblanc. Mathieu Roy, Como, l'Acadie Nouvelle.
Bonjour. Pour la personne qui pourra répondre à ma question, je me demandais si on a les certitudes que les travailleurs étrangers temporaires qui arrivent au Nouveau-Brunswick, ceux qui sont infectés, mais pas seulement, si on a les assurances qu'ils ont accès à toute l'aide nécessaire pour s'isoler. On sait que ces gens-là n'ont pas notamment de famille avec eux. Est-ce qu'on sait si on les traite bien et puis si ils ont l'aide nécessaire pour qu'ils n'aient pas à sortir et puis qu'ils puissent vivre leur confinement de façon sécuritaire?
Oui, alors les directives nationales et provinciales peuvent nous rassurer qu'ils sont protégés au niveau de l'isolation, isolement, et aussi qu'ils ont toutes les choses nécessaires puisqu'ils peuvent faire ça en sécurité.
Merci, docteur. Monsieur Roy, comment as-tu un suivi?
Oui, merci Bruce. Pour le Premier ministre Higgs, cette fois-ci, ça fait longtemps que vous dites que vous étudiez les programmes fédéraux d'aide aux entreprises pour que la province, elle, puisse finalement s'occuper de ceux qui tomberaient entre les cracks. Je sais que vous préconisez l'aide individuelle aux entreprises qui se tournent vers Opportunité Nouveau-Brunswick pour de l'aide. Envisagez-vous de nouveaux programmes pour aider les entreprises? Je pense notamment au secteur du tourisme là, qui risque d'avoir des difficultés cet été.
We are looking at how the tourism industry can be impacted. And we're also focusing very much, that's why the discussion on the not only interprovincial tourism, but also on the potential bubbling with Nova Scotia and PEI to enhance the business. We are working with different operators. I know that the tourism department have been in direct discussion with many operators. It's more about how, and we've worked with companies all over the province in promoting tourism within New Brunswick. So I think it's along the same line as we're looking to focus our efforts where they're needed in order for people to get up and running and moving. I know it's an easy thing, but I would say short-sighted for just someone to say, well, I'm going to put out this many new programs, but I'm not sure what the result's going to be for those. We are working closely with the operators, be it in tourism or be it other business operators, to watch their companies come up and become viable once again. And that's my point when I raised the comment earlier about we're growing, and the current RBC report says we are opening up faster than any other province. We are actually seeing, I think we've gone to about 65% now of our companies, maybe 70, that are fully opened. And we're very pleased with what we've seen in the last, let's say, 3 to 4 weeks. So it is moving well. And I guess what people need to think about is this. You know, if I turn to just one program after another, then there's only one person that's going to end up paying for that. Well, actually, there's 780,000 of them potentially, because it's every taxpayer in the province, it's every business in the province that it'll come back around in the form of new taxes. So what I'm trying to do is say, I'm not only, you know, working with you individually to make sure that we can move forward quickly, but also I want to be part of a solution for a long-term recovery in New Brunswick and a long-term pre-COVID success story, or post-COVID success story, sorry. I want to be able to be able to see and show people and businesses that they can invest in the province, because we're seeing a future post-COVID, and we're going to be able to grow like like no other province, because we're looking strategically at where we can rebuild our province and beyond.
Thank you, Premier. Merci, Monsieur Roy-Comont. Before we go to the next one, Monsieur François Leblanc, une précision de Dr. Russell maintenant.
Oui, sur la question des concerts de musique, quand que j'avais dit que ça peut être quelque chose qui se fait dehors, je voulais dire que ça peut être fait dehors avec les voitures, dans les voitures.
Merci, Dr. Laurel Lyle, CTV Atlantic.
Thanks, Bruce. This question is for Dr. Russell. We've heard that the mass testing of employees at the Campbellton Regional Hospital started this weekend. I'm wondering why it was, or I guess why it took until this Saturday to do that sort of larger scale testing at that facility.
Well, my understanding, and again, I might have to dig around for some details, but my understanding is that there has been ongoing testing with anybody working with COVID patients from the beginning. So in terms of testing more widely, I think that would have been only as a result of finding new cases. So, but the original plan from very, very early on was to test all staff who were working with COVID positive patients on a regular basis. So I think it's supposed to be twice a week, but that is my understanding. So this is, we would have only received the extra cases of people working not directly with the COVID positive patients. So that would have been the motivator or instigator of testing more widely.
Thank you, Doctor. Ms. Lyle, do you have a follow-up?
I do, thank you. This question is for Premier Higgs. With the death of Rodney Levi over the weekend, do you have any plans to go and visit the First Nation, the Red Bank First Nation?
Well, we actually have a major meeting that was set up for this Wednesday. It was previously set up as to discuss the justice issues. Now it has got a broader agenda. I would have not originally been attending, but I am attending now. It'll be, we've asked for additional items that will be put on this agenda to kind of set up a path forward for discussions. To move beyond, certainly justice will be one factor, but move beyond as a result of these tragic events that we've seen in our province over the last few weeks. So this is the beginning of a process to really see areas that we can focus on collectively, areas that we can get results collectively, and we can see the bar being raised for improvement in New Brunswick and these issues that are so tragic to our society.
Thank you, Premier. Edouard Rodriguez, Radio-Canada. That concludes today's update. Thank you very much. Cela conclut la séance d'aujourd'hui. Merci beaucoup.